Hello everyone, welcome to my channel Ravi Static Future. So in the series of pharmacology, we are moving further and taking another topic which is GABA cell. So we are studying the neuropharmacology, and the GABA receptors is important for the neuropharmacology. Why? Because it is a neurotransmitter from one neurons to another neuron, like presynaptic neuron to postsynaptic neuron. So let's study about that. So what is the GABA? So it is the chief inhibitor neurotransmitter in the mammalian central nervous system. So what? So it is the transmitter of the mammalian of the nervous system. So what is the full form of GABA cell? So ambibutyric acid. So it is a acid kind of substance which is transmit the signal from presynaptic membrane of neuron to postsynaptic membrane of the neuron. So its role is in reducing the normal excitability, and in a human it is also responsible for the regulation of the muscle tone. So if any kind of hyperactivity of muscles or a hypoactivity of the muscles, all of the control systems which is GABA cell receptors who have the cell send the signals from one neurons to other neuron, either it will be activity do or either will activity not do, or also help in reflex arc to perform the different activity. GABA function as the brakes to calm and show it down. It also have to like break down the signal. Basically, it will also help to stop the different signals if there is an hyperactivity of doing any kind of movement or activity. GABA sends to inhibitory message by binding to a special site called GABA-A receptors on the outside of the receiving neurons. Once GABA is bounded to the GABA-A receptors, the neurons open to the channel which allow the chloride ion to pass inside the neuron. It means inside the GABA there is a GABA-A receptors which is present, and if the GABA-A receptor star bind with a neuron which is postsynaptic neuron, so it help to open the channel, like calcium channel or like inside the cell, to allow the inside of the neuron of the chloride for performing or send the chloride information into the body or different functions into the body. So note, GABA binds with the GABA receptors, open calcium channel. The calcium channel influx, like inside the calcium channel enters, hyperpolarization will be occur, and the neuronal firing is to be shown that, and the fast inhibitory action. If the person is taking any kind of medicine, it will be bind to the GABA A and open the calcium channel. And if calcium channel is open, the GABA receptor is ready to enter influx of the calcium channels. Like it will be like again it will activate the hyperpolarization of the cell activity, and the neural firing is to be stopped and reducing, and the contraction of the muscle will be slowed down and inhibit them. It is the performance of the GABA A cell. Next is to be GABA B cell. It is the metabolic G protein coupled receptor. Represent the mediate slow prolonged inhibitory neurotransmission in the central nervous system. Ions involve potassium and like potassium and calcium. Note, GABA A binds with GABA B, activate G protein, open calcium channel, potassium efflux, closes calcium channel, and decrease the neurotransmitter release, slow the prolonged inhibition. So the GABA A binds with the GABA B and activate G protein and opens calcium channel, and calcium channel further it will be efflux the calcium ions and closes the sorry open the potassium channel, and potassium channel influx into the cell and closes the calcium channel. It will be decrease the neurotransmitter release, and if there is neurotransmitter it will be restricted, so it's slow down to the activity, and it will be slow prolonged inhibition of firing rate of the neuron. So that is the function of GABA B. Next is to be GABA C. Are inotropic pentameric ligand gate chloride channel type is inotropic, similar to GABA-A but mainly found in retina. So what is their action? It's the inotropic. It means in their receptors there is a present of ions, like into the retina there is a present of ion, and it will be so the pharmacological action similar to the GABA-A. And similarly, if you are taking the GABA, like any sedative hypnotic medicine, so it will be dizziness and cause the sedative effect or hallucination in your mind, and hypnosis, anxiolysis, anticonvulsant effect, a muscle relaxation. It means if you are too much pain, and if you are not insomnia kind of things into your mind, and not like too much firing rate or spasticity of your neuron or hyperactivity of your muscles, so it will be relax them. So if there is any kind of symptoms will be so that, so GABA C receptors which is inotropic and present in our retina. So if you like taking the GABA medicine, like sedative hypnotic medicine for relax their hyperactivity of the body, like hypnosis, and like not hypnosis is like the spasticity and or like hyperactivity of the muscles. So clinical use: anxiety disorder, epilepsy, insomnia, muscle spasticity, or alcohol withdrawal. So these kind of condition you have taken the GABA-C medication, like sedative hypnotic medication, and there is some adverse effect if you are taking too much GABA's medicines or like sedative hypnotic medicine. So there is a drowsiness, confusion, like dependence of benzodiazepines. So the benzodiazepines is one medication which is helpful to cause the hypnosis and anxiolysis or sedation effect. Or also if you are taking too much, it will be also called the dependence over the medicine for like sleep cycle and like different activity. So if you are not taking a medicine a single day, so it will be like you have to feel like drowsiness, nausea, and like different another factors in your body. But make sure you have to be consult to the doctor before taking the medicine. Respiratory depression also there is a occur if you are taking too much dose of benzodiazepine. So that is the GABA cell receptors or their action of the GABA-A, GABA-B, and GABA-C, their types and their action. Thank you.